Hey everyone, and welcome back to Breaking Down Nursing. Today we're going to focus on pediatric safe dose ranges. So before we get started, let's talk about some key differences between adults and peds. Now keep in mind that all pediatric patients and dosing is weight-based. Unlike adults where everybody kind of gets the same dose regardless of weight, kids are much different. We can have kids that are a couple of kilograms to almost adult-sized children. So weight is everything for these kiddos. Also remember, organs are still developing. Not every medication could be taken by pediatrics. And there's also a high risk for toxicity. We have a very narrow therapeutic range. And so we have to make sure not to have any toxicity. So let's get started with our first question. A 14-year-old boy who weighs 193.6 pounds with pneumonia is receiving IV Zosyn 3,000 milligrams Q8 hours. Safe dose for Zosyn is 240 to 400 milligrams per kilogram per day. So remember from previous videos, we always want to underline the key things first. That would include 193.6 pounds, 3,000 milligrams Q8 hours, and of course our range of 240 to 400 milligrams per kilogram per day. So what's our question? What is the safe dose range per day? So we're going to start with our pounds because we need to convert pounds to kilograms because everything is in kilograms for pediatric ranges. So we'll write out 193.6 pounds and we'll convert this to kilos. Pounds will go on the bottom since we're trying to cancel out our pounds, and kilograms will go on top. And with knowing our conversions, it's 1 kilogram is 2.2 pounds. When we cancel out our pounds, we're left with kilograms. And after we do the math, 193.6 times 1, and then divide it by our denominator of 2.2, we get 88 kilograms. Well, now we have to find our range, which means we have a low end range and a high end range in milligrams per day. So the low range for Zosyn, as known in the problem above, is 240 milligrams per kilogram per day. On the high end, it's 400 milligrams per kilogram per day, but we'll find that out after we find out the low range. So we'll start with the 240 milligrams per kilograms per day. What we're looking for is milligrams per day, so we need to cancel out our kilograms. Well, we know that the patient's kilograms after we converted earlier was 88 kilograms. So since kilograms is on bottom, kilograms will go on top. 240 milligrams per kilogram per day times 88 kilograms over 1. Now we just have to solve and do the math. So 240 times 88 divided by 1 is 21,120 milligrams per day. Now we have to go to our high end. And so again, from the problem above, we know that our high range is 400 milligrams per kilogram per day. And we'll do the same that we did with the low range, is we need to get the milligrams per day and we need to cancel out the kilograms. So we'll multiply that by 88 kilograms because the kilograms and milligrams per kilogram per day is at the bottom. And so we need it to be on top to cancel. Now we can do the math. 400 times 88 divided by 1 is 35,200 milligrams per day. Let's move on to the next part of the same question. So with our same question, what is the safe dose range per dose? So now we're looking for the low end, which is milligrams per dose. Remember previously we were looking for milligrams per day, but now we know that the patient's getting it every 8 hours. So we've got to factor in, instead of it per the day, per every 8 hours. So we're going to take our milligrams per day that we had in the previous question for the low end and the high end. So we'll start with our low end, which was 21,120 milligrams per day. Now we need to get to milligrams per dose, so we need to cancel out our days. And we know a conversion factor for days is 1 day is over 24 hours. And in our problem above, we know to convert out our hours to get 1 dose, they get 1 dose every 8 hours. So 8 hours goes on top to cancel out the hours. And when we cancel out our days and hours, we're left with milligrams over dose. So when doing the math, we multiply all the numerator together and multiply all the denominator together and divide the numerator by the denominator. So it'd be 21,120 times 1 times 8 over 24 times 1. And so when we do the math, we'd have 7,040 milligrams per dose. Now we have to do this for the high end. We know from our previous problem that we have 35,200 milligrams per day. And we use the same setup. To cancel out days, we'd have 1 day over 24 hours. And then to cancel out our hours, we'd have 8 hours is 1 dose. When we cancel out the days and hours, we're left with milligrams over dose. And when we do the math, it'd be 11,733 milligrams per dose. Let's move on to another question. The doctor ordered Augmentin 150 milligrams PO every 8 hours. Your child weighs 20 pounds. The drug guide states children less than 40 kilos receive 6.7 to 13.3 milligrams per kilogram every 8 hours. Available is Augmentin 125 milligrams in 5 mLs. As with all questions, we need to underline the key important details. So 150 milligrams PO every 8 hours, 20 pounds. Children less than 40 kilograms receive 6.7 to 13.3 milligrams per kilogram every 8 hours. And then of course 125 milligrams in 5 mLs. Now we're looking for what is the safe dose range per dose. So remember, we have a range here, so we have to find the low end and also the high end in milligrams per dose. So we'll start with what we know. We'll start with the 6.7, which is the low end of the range in milligrams over kilograms. We need to get to milligrams per dose. So when looking at this, we need to cancel out our kilograms. We know that the patient's weight's 20 pounds. That means we need to convert kilos to pounds. So we know that 1 kilogram is 2.2 pounds, canceling out our kilograms. And then we can add in the patient's weight of 20 pounds over 1. That would cancel out our pounds, leaving us with milligrams per dose. When we do the math, 6.7 times 20 divided by 2.2 is 60.9 milligrams per dose. Now we need to take that exact same equation and use it for the high end milligrams per dose. We know in the high end range it's 13.3 milligrams over kilograms. Next we need to convert to pounds so we can get our milligrams per dose. So 1 kilogram is 2.2 pounds, and we'll effectively cancel out the kilograms. And then we'll put the patient's weight at 20 pounds, canceling out our pounds. When we do 13.3 times 20 divided by 2.2, our answer is 120.9 milligrams per dose. Moving on to the next part of the question, it says, is the ordered dose in the safe range? Well, we just figured out our safe range, which was 60.9 milligrams per dose and 120.9 milligrams per dose. And in the question, the doctor's order is 150 milligrams PO every 8 hours, which is outside of our high range. So no, this is not a safe dose. When looking at ranges, I always recommend writing out the low end and making an arrow in between and then putting the high end on the other side. So when you look at the ordered amount, you can see whether or not it's inside that range or not. It's easier to visualize it that way. All right, guys, that wraps up our breakdown of pediatric safe dose ranges. Remember, with peds, small calculation mistakes can turn into big problems. So always slow down, double check your math, and compare your answers to the safe range before giving any medications. If this video helped make peds dosing a little less intimidating, make sure to like, subscribe, and share the channel with other nursing students who are struggling through dosage calculation right now.